This is Plant-Based Briefing, Who's Controlling the Health Narrative? How Media Trends Are Rewriting Public Health, by Klaus Mitchell at nutritionstudies.org. And I'm Marian Erickson, host of this curated content plant-based podcast, where I narrate articles about plant-based and vegan living with permission in about 10 minutes or less every weekday. And I'm pleased to have permission from the Colin Campbell Center for Nutrition Studies to share their content. And today's article is written by Klaus Mitchell, one of the founders of Plant-Based News. I've also reached out to them just recently to ask if I can share some of their content, so hopefully they will say yes, and I'll be able to share more directly from them as well. But now let's get to today's Plant-Based Briefing. Who's Controlling the Health Narrative? How Media Trends Are Rewriting Public Health, by Klaus Mitchell at nutritionstudies.org. In the not-so-distant past, most of our health information came from textbooks, physicians, and peer-reviewed journals. Today, it comes largely from viral social media posts, including TikTok videos and Instagram reels, many of which have more flair than facts. The line between education and entertainment has blurred, giving rise to what some now call health entertainment, a space where influencers can outpace experts in shaping public perceptions about food, fitness, and health. But as engaging as a 30-second wellness hack may be, these trends raise important questions. Who's controlling the health narrative, and at what cost? The influence of social media on health behaviors is already well documented. A narrative review published in 2023 highlighted how social media has become a dominant force in shaping public perceptions of health. The review recognized that this impact can be either positive or negative. Social media can allow qualified individuals to provide free and digestible health information to a large audience, but it can also facilitate the spread of misinformation and disinformation. In particular, the review underscores how frequently platforms amplify content that demonizes entire food groups, promotes unproven quick fixes, or relies on fear-based messaging, all of which can distort public understanding of health in ways that are more harmful than helpful. Even well-meaning misinformation erodes trust in evidence-based medicine, skews dietary choices, and delays medical interventions. For example, a National Cancer Institute-funded analysis found that 77% of highly shared cancer-related social media posts contained misleading information, including advocacy for unproven treatment over proven ones. A 2021 study found that nearly 40% of UK adults are exposed to contradictory nutrition information. I was surprised this number wasn't higher, and I'm almost certain that today it would be over 50%. This resulted in nutrition confusion, along with net negative engagement with healthy behaviors such as regular exercise and the consumption of fruit and vegetables. Meanwhile, another study found that critically urgent health topics like smoking and non-communicable diseases, chronic diseases like diabetes, cancer, and heart disease, made up a particularly significant amount of social media's health misinformation. This in turn is causing further health crises and a rise in preventable deaths. The spread of misinformation is growing too, and healthcare workers have repeatedly said that this phenomenon makes inequalities worse. High-profile figures such as the U.S. Health Secretary Robert F. Kennedy Jr. are currently promoting disproven and dangerous myths related to health and nutrition, further blurring the line between trustworthy versus untrustworthy sources. For example, when he appeared earlier this year on the podcast of Paul Saladino, a major proponent of the carnivore diet, the secretary implied that bacon is not a processed food. This and other comments made by the secretary are at complete odds with the scientific consensus. And the situation is worse than many may realize. The challenges are bigger than one man. Although Kennedy rightfully receives added scrutiny because of his current position, individuals and groups from across the political spectrum are guilty of spreading misinformation and contributing to public confusion. Online, a small core group of super spreaders expose up to 24 million vulnerable social media users to harmful advice. Notably, most of these spreaders benefit financially from promoting misinformation, profiting from unproven therapies and extreme lifestyles. Proponents of the carnivore diet, for example, may profit from selling meal plans, guidebooks, or supplements, despite inconsistencies in messaging and a lack of evidence for the diet's so-called benefits. Health misinformation represents a missed opportunity to educate. The problem isn't just misinformation itself. The broader issue also represents a missed opportunity. When sensationalism dominates the spotlight, the voices of trained clinicians, scientists, and public health advocates are drowned out. As a result, messages rooted in rigorous evidence, such as the potential for whole food plant-based diets to prevent, treat, and even reverse chronic disease, while also addressing environmental crises, can struggle to reach the audiences who need them most. Yet there is hope. The same platforms that spread misinformation can also be harnessed to deliver truth. This is the approach we take at Plant-Based News, the platform I founded nearly 10 years ago. We publish thousands of videos across social media, including YouTube and Instagram, that aim to educate and inspire every year. We also collaborate with organizations similarly focused on combating misinformation, like the Colin Campbell Center for Nutrition Studies, or CNS. Organizations like ours and CNS help to amplify evidence-based health and nutrition information in a way that is accessible to all. You just listened to Who's Controlling the Health Narrative? How Media Trends Are Rewriting Public Health by Klaus Mitchell at nutritionstudies.org. And I'm your host, Marian Erickson. As I mentioned in the intro, hopefully I will get permission to share more content from Plant-Based News. Klaus Mitchell wrote this article for Nutrition Studies, who I do have permission to share from, which is why I'm able to narrate this one. But let's continue to do all we can to share the appropriate information and try to get that message out. Share articles and posts from Plant-Based News, from Nutrition Studies, from Nutrition Facts, from this podcast. Please share it and get people to listen to it who you think might be open to the message. So please share this episode with anyone who might benefit, and thanks for listening.